Good morning, everyone. Thank you for being on the call. It is a wonderful Monday morning here. It is August 22nd, 9:03 a.m. Thanks for your patience, and thank you guys for being on this call. Very important updates and things I'd love to show you guys today. I did notice that things are starting to pick up a bit, and I know you all are working on your marketing, doing events, meeting with doctors, going to rollout sessions, and some of that may interfere with this call. So as a reminder, these calls are being recorded, and we host them on our YouTube channel. So in the chat, I just went ahead and posted our channel link. There should be a button there that will show you how to subscribe. Just subscribe there, and so anytime we pop in a new video, in case you missed it, it will go right to your phone, laptop, or iPad to let you know, hey, there's a new update available. And again, if you need help, just reach out to HPM team member, and we're glad to get you set up on the YouTube channel there, so that way you can get those updates when you're on the road. So with that, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. But we've got to know what we're talking about. So let's figure out where the training is. And so for my first trick this morning, I want to start looking at the training calendar slightly different today. And one of the reasons I'm doing that is because we have built out the incredible gold key. And I want to share with you guys how to get to some things here. So from the top of the gold key, you'll go into training, and then you'll see our HPM training calendar. So we've got lots of trainings, but you click that HPM training calendar, and all of our trainings are embedded right here in the gold key. So this, you can kind of get to it a little bit quicker if you want a month overview of what's happening. So for instance, today at 9 o'clock, we have some folks at the Aetna 2023 rollout session that's happening online. Again, if they've got the YouTube channel, they'll get notified once this call is over, and they'll get a copy of it. So that's happening today at 9 o'clock from 9 to 10:30. Also at 11 o'clock today, Cigna is doing their kickoff session in, looks like Palm Harbor, and that is at the Outback Steakhouse. You can reach out to Mark Ianello there. His phone number and email is there. Also at 11 o'clock, United Healthcare is doing their rollout session in Ocoee for our Central Florida folks. That's at the West Oaks Branch Library. You can check that out. And then there's another Aetna rollout session today at 1 o'clock. So if you missed the one at 9, don't panic. You can jump on the one at 1 o'clock. And then at 2 o'clock, United Healthcare is doing another rollout session. So they've got one at 11, and then at 2 o'clock. The RSVP link is in the calendar there. Just click that link. Tom Ryan was kind enough to put all this together for you. Thank you, Tom. Moving on to tomorrow, Tuesday, the 23rd, Humana is doing their rollout session for the Central Florida market, Orlando, at the Exploria Stadium. That is where the Orlando City soccer team plays. So if you're wondering where the heck Exploria Stadium is, they just renamed it. So that's downtown Orlando, and it's the only stadium there unless you go to the Citrus Bowl and you've gone too far. So Exploria Stadium is where the Orlando City soccer team plays. That's at 10 o'clock tomorrow. From 10 to 12. So go check out what Humana is rolling out. Rumor on the street is they're getting super competitive. So very excited to see what they've got rolling out. Tomorrow at noon, Baycare is doing their producer kickoff meeting. And that is, you can check that out at noon. And that is tomorrow at noon. There's the link there. And then 2 o'clock, Humana is doing another session at Exploria Stadium. So one at 10. One at 2. So sign up for a session there. Go check out what Humana's got going on. Wednesday, moving on to the 24th, 9 o'clock, there is a webinar, Buyer Insights, a look at the shopping and switching habits of today's Medicare consumers. This is really important as we're getting ready to go in AEP. This is going to give you some data and analytics on what's happening nationally with our seniors. How are they shopping? What benefits are they looking for? What's making them go out and take a look at what's going on? It's a really powerful insight. So that way, when you're sitting across the table from somebody this AEP, or you're on the phone with somebody this AEP, you kind of get an idea of what's making them tick. Okay. So really great webinar. That's at 9 o'clock on Wednesday. It's only about an hour. It's completely free. Go out there and sign up for that if you want some great insight. Also at 10 o'clock on Wednesday, Emblem, if you're doing business in the Connecticut Northeast area, Emblem is doing their plan webinar. That's at 10 from 10 to 11 on Wednesday. And then 11:30, Freedom has started their rollout sessions, Freedom Healthcare. This one's in Fort Myers at the Crown Plaza. You do need to RSVP for the Freedom events because it is limited seating. So just make sure you, if you're in that area, in the Fort Myers area, that you RSVP. Moving over to Thursday, the 25th, Freedom's Orlando Kickoff is happening. Their rollout session at 10 o'clock. That's at the Orlando Hilton. Please RSVP if you haven't already. Many of you have gotten physical cards in the mail. It look like this, and that's from Freedom Health. Save the date. So you do need to RSVP for that. So the Central Florida, that's at 10 o'clock on Thursday. Also on Thursday, 11:30, Devoted's doing a coffee and chat session. You can jump in there and get your questions answered, anything Devoted related. 1 o'clock, Cigna's doing their kickoff session on Thursday in Jacksonville. Jacksonville is an expansion market for Cigna. It's the first time that they're going in with a Medicare Advantage plan. So if you have any clients that are in Jacksonville or may move to Jacksonville, Cigna will be there. If you don't currently have Cigna and you're in the Jacksonville market, please reach out to us so we can get you contracted. That's at 1 o'clock on Thursday. Their kickoff is there. And then last thing on Thursday at 3 o'clock, we are doing another advisor meeting. And this is our breaking news at HPM for Devoted. We're going to be hosting that at the Second Harvest Food Bank on Mercy Drive. So that's kind of close to where our West Colonial office is, from 3 to 6 o'clock. So make sure you save your seat there. We have a link that we emailed out to everybody. Just RSVP there, or you can give us a call and we'll RSVP you for that one. That's Thursday at 3 o'clock. Finally, Friday, 10 o'clock, another session for Freedom. The rollout session is happening at the same place at the Hilton. So you can either do that on 10 o'clock on Thursday or 10 o'clock on Friday. And then, Ocala, they're doing a 5 o'clock one. So if North Orlando or Lake County is a little bit easier for you, they're doing a session in the Villages. That's the Ocala rollout for Freedom on Friday at 5 p.m. Nothing like a rollout session to start your weekend, right? There you go. So that's the training for the week. Please make sure to keep one foot in the classroom and the other one in the field at all times. Now, I do want to just a quick update about Florida Blue. Florida Blue is closing their contract starting September 1st. So if you are not currently contracted with Florida Blue, you will have last opportunity to contract this year, September 1st. So that's next week. This may be the last announcement I make. If you're currently contracted with Florida Blue, you do not need to worry about it. But you do need to start the contracting process in order to avoid that blackout. If you come to us in October and say, you know what, my clients are asking me for Florida Blue, so sorry, Charlie, come back in January. We will not be able to contract you with Florida Blue until after January if you miss the cutoff on September 1st. So just want to make sure everybody's aware of that. If you are considering Florida Blue, now's the time to do it. Get that contract going. You can reach out to your manager or reach out to us at HPM and we'll get you contracted and ready to go. Okay, now let's talk about the kickoff because that was brought up here this morning. So the kickoff, we are almost at capacity here. We have 12 seats available, 12 seats left. So please make sure that you RSVP for our kickoff session on September 8th. That is in 17 days, 4 hours, 47 minutes, and 0 seconds. So we really appreciate that you RSVP for that event here. I've got our countdown clock on the front page. If you've already RSVP'd, you should have received an email confirmation. There's a quick little video here. Just make sure you RSVP. If you're coming in a group or you have multiple people with you, just make sure that each person RSVPs individually. please do not RSVP for them because we need an accurate headcount in order to be able to properly feed everybody. And we also have a fire marshal thing there so we don't get kicked out. So the agenda there, it's going to start at 2 o'clock. We're going to have our welcome reception in the main lobby. We're going to have some great vendors. So far, we have Centerwell, Direct Mail IO. This is our mail house that we love to connect you with. United Healthcare, Humana, Devoted, Dedicated Senior Medical Centers. We've got WellCare that just committed and Care Plus that just committed as well. So looking forward to adding those guys onto the list here. Very excited to have them up and running at our rollout session. So make sure you RSVP for the kickoff. Again, there's only 12 seats left. If you haven't done so, email is in there, or you can go to ask a team member here, and we'll get you to the RSVP, or you can give us a call. We'll get you set up there. Okay, let's talk about call recording, because this seems to be a very big thing. Now, I am going to be hosting a full training update session on September 2nd. And I believe it's going to be at 9:30. So if you want to mark your calendar in the morning, September 2nd at 9:30, I'm going to be doing a full webinar or training, or whatever you want to call it, an update on call recording and the requirements from CMS now. I'm going to be talking about the solution that we found here, and I'm going to explain that here in a minute. And also, the requirements and the exceptions to the rule, and how we're managing all of this moving into AEP. So you don't want to miss that. I will be announcing it and sending it out in an email and text message as well. So don't panic. I will send you an RSVP for that. This is a live update, live session, and I have lots of great things to show you guys, as well as some solutions to this recording as well. One of them is what we found here today. And so what we found that we feel is going to be best solution for you as an agent is what we call what's known as Ring Central. Now, Ring Central is one of the largest telecommunication companies in the country. We currently use them at Health Plan Markets internally with our team. And we also have most of all the capabilities that I'm going to share with you today. Now, looking at you as an agent or an agency, one thing that you have to remember is that you are in business for yourself. This is your business, and you are ultimately responsible for your communications with your clients and how you manage those communications. Okay. So as a business owner, many of you have been running your business from your cell phone, and that is okay. There's nothing wrong with that. But I know some of you that have outgrown your cell phone, and you need a little bit more than just a regular cell phone. Many of you can't turn off your cell phone. Many of you can't go on vacation because your phone rings because your clients have your personal cell phone number, right? So this gives you a solution without having to buy a second phone. You can integrate it into your cell phone, okay? So Ring Central is an app that you would put on your phone and on your computer and on your iPad if you prefer. It all integrates. And what we found is, the main concern is how are we going to capture call recording with our day-to-day interactions with our clients? Because CMS says that you have to record every interaction, even if they call and say, I didn't get my ID card, I want to change my doctor, or I have a question about my health plan. All of those interactions need to be recorded. Okay, so this will give you that solution. Okay, now it's $27.99 a month. All right, but I'm going to go through this with you because I think that this is the best value and the best solution available. Many of you have a cell phone, and if you're thinking, oh, $28 a month, wait until you see what this thing has. Okay, so for $28 a month, you're going to have the call recording capability. It's going to store your phone calls for you. It's on demand. You can use the phone on your phone, laptop, or iPad. So you can actually do soft calls from your computer. Okay, so you put on a headset and you can call from your computer, so you're a little bit more comfortable, just like a call center. Okay, I do this every day Many of you don't even know that I'm calling from my computer. Okay. You can switch back and forth while on a live call. You can switch from your phone to your video and all that. It comes with the video recording. It comes with a fax machine as well. So it has a virtual fax line. So some of you that have a fax line at home, you're probably paying $28 a month for that fax line. You can replace it and it's integrated. It's unlimited internet fax, unlimited phone calls, and you can do audio conferencing. So 3-way calls, 4-way calls if you need to. But 3-way calls are really, really great, especially if you need to get somebody on the line with customer service, or hopefully Spark member services. You can connect and do a warm transfer on that. You get a video meeting room that's dedicated to you. So if you want to be on camera and do share screen with your clients remotely, which is what I highly recommend during AEP, just because it's going to save you a ton of time, windshield time. You can actually invite up to 100 participants into your Ring Central video meeting. So you can do online seminars, which is really cool. And it does do as well some of the integrations as well. It's got voicemail, and check this out. You can go on vacation and you can forward your calls or turn off your business line. Okay. Now the next question most people ask is, well, everyone's got my personal line. What happens when they call me on my personal line? Very simple. You're going to say, Mrs. Jones, thank you for calling me. Glad to help. CMS is now requiring me to record our interactions. I will need to call you from my business line so I can record that call. Are you okay with that? They say yes, and you bounce over to your phone, your business phone. So that's best practice. Again, on September 2nd, I'm going to go through all of that on how to handle calls, how to do call recording. The storage and all of that is handled by Ring Central. I don't know if it's going to be stored for 10 years, but we're going to tackle that with them as well. But this seems to be the best solution as well. We use this, so our team is very familiar with how to use Ring Central. So that's why we're leaning into this. So if you had a question on how to do something with Ring Central, you can reach out to us and we most likely will know the answer or can find the answer for you. Now we have a corporate account, so you don't need any of that. One thing I will mention is you can go out and buy this on your own. There is an essentials package that is $19.99 a month. That one does not have call recording, so don't buy that one. It's the second one. It's called the standard plan, and it's showing $27.99. Now the pricing is based annually, so just pay attention to that because it does jump up if you're only going to pay month to month. So it's $27.99. You pay for the whole year up front, and it works out to be about $28 a month. So those of you that understand that infrastructure is important, this is a great solution and a great way to record your calls. So again, I'm not going to dive any more deeper into that, but I just wanted to get that off my chest because a lot of you are coming to me and saying, hey, what do I do about these call recordings? September 2nd also is the day that I'm going to be doing a full training session on call recording. So there it is. All right. One thing I wanted to also share with you guys is the Gold Key now has a shortcut. And I am going to be jumping in and sharing my link here. Save this link. We've made it super easy now. So it's joinhpm.com/goldkey. So instead of that long one that I sent you guys before, joinhpm.com/goldkey. It's in the chat. Just save that link, and this is going to give you your brains. Remember, we talked about brains book in your business. We're going to be talking all about that at the kickoff. The Gold Key is your everything, okay? I just showed you how to get to the training calendar from the Gold Key this morning, and also want to share with you an update. And there's several updates because this thing is getting updated every day, all day, every day, with new information about call recording, Medicare information, training sessions, rollout sessions, first looks. All of this is getting updated. Recertification links, all of it's there. And we're continuing to make it better. So as you're exploring this portal system, our Gold Key, if you have any suggestions, please let us know. We're happy to enter or delete anything that you think is necessary. I do want to share with you the updated dedicated form. So you go over to PCP appointments here, and we do have, I'm sorry, that's not the right one. Let's go back. We're going to go down to provider relations. And under provider relations, we have a new dedicated lead transfer program form. And many of you were saying, hey, I sent some folks into dedicated, but I haven't gotten compensated for setting up that appointment. Okay. And the reason why is because dedicated really didn't have a great system for tracking those appointment sets. So just like CenterWell, you have a dedicated line. This is going to be the same program with dedicated, and they do compensate you for that appointment. Now, we created a specific form. So this new form that you're seeing here goes directly into the director's email every time that you submit it. So it should clean up their system as far as who is owed what as far as appointments are concerned. So we created this form for them internally, and this should streamline the payments with dedicated. So on behalf of dedicated, I had a meeting with them. They apologized for any delay in payments. And then I discovered a way to fix it to make it faster. So this is how we're doing it. Now, it's very important. There's two things here. Number one, you have to attend the training session, which is listed back there in the gold key. So you'll go under, on the gold key, you're going to go under the PCP appointments. And then you'll see the training there, PCP appointments. And then there's a dedicated senior training there. It's a quick video. It's 10 minutes long. You can watch it in fast speed if you want. It's 5 minutes long. And there's an attestation that you have to fill out. In order to complete and be listed on as an approved agent, you do need to make sure that you get that training done. Only those folks that have been done with the training will be entered onto the form. And it's because they need to track your phone number and they need to know that you understand the program. Okay, so that's really important that you get that done. So I do apologize to anybody that may be missing some dedicated. If you can please enter that form, and we will ensure that we can get that information in as quick as possible to get you guys compensated on that as well. So thank you for your patience on that, but we did work that out and got that done. Okay, let's move over to AEP. Now, if you're not preparing for AEP, you got to get with it. It's August 22nd. We are almost a month away from go time, and it's here, guys. Okay. So first thing is obviously retention, and I want to point out that we are leaning heavily on Spark for their retention plays, and they have an incredible retention campaign case study that I wanted to share with you guys today. And this is a case study that they used last year, I believe it was. And so in this particular case study for AEP retention, it reduced churn for 60% of members engaged in the campaign, which saw a 15% member completion rate of a 25-question digital survey. Okay, and I'm going to share with you guys what that looks like today, because it is really, really powerful. Educating and retaining clients at risk of churn. So let's say you send it out to 100 members, 83 say they're happy with their plan, 17 are not happy, okay? Within that, they might say that they are unsure if they're gonna switch their plan, or 26% here say that they are gonna switch their plan. And so you can see that you can avoid the churn on this because they can complete those survey questions to ensure that everybody is being taken care of during AEP. Now, here's some more generating insights for recommendation and post onboarding support. In this particular example, what members like about their plan, the survey will tell you that 33% enjoy access to providers, low copays and premiums, low cost medications, benefits, and others. And then members considering these benefits in this particular order, vision, dental, OTC, hearing, gym, and transportation were key factors for last year. In this particular case study, 97% completed the campaign via a web app, and 3% called a navigator, which is Spark's member services navigators. And if your member calls that number to complete the survey, it's really, really interesting to see that many of them are doing self-service. 15% of the campaign completion rate, so 15 minutes across 25 questions. Okay. Let me show you what this looks like here. During your AEP campaign, let's go back here. All right. So AEP, and I got a sneak peek of this. We just launched part 2 of the Spark platform, and it talks in depth about all of this. But you will get a customized postcard that looks exactly like this with your picture, your name, and your phone number on it. And it says it's that time of year again. It's Justin checking in on how happy you are with your health plan. They scan that, or they call the number to member services. There's the front of it. And it will take them to a simple questionnaire. Now, this questionnaire is based on the book of business that you uploaded into the system with this. And so you're going to start seeing in your CRM system that we're helping you collect their drugs, their doctors, their specialists, and all of the interactions. So you are shortcutting all of those questions in the AEP. You open up their profile and you've gotten everything that they submitted on their own. If they moved, if they changed their phone number, if you were missing an email, all of that data is going directly into your CRM system, and your members are updating it themselves, or the navigators are updating it for you. So lots of admin stuff that you're avoiding just by using the member services department at Spark. So I wanted to share that with you. The deadline to get this AEP campaign done for you is September 15. However, there is a timeline. It's probably going to take you about a week to get everything in order. So time is moving, and I want to make sure that that you get this done on the member services department. So let me go back here to the gold key on how to get started with that. You're going to see the Spark platform. Please watch that webinar so we can ensure that you get all the information and get started. Then you'll need to sign the terms and conditions with Spark, and you'll upload your book of business, and there's directions on how to upload your book of business. From there, they will reach out and help you set up your AEP campaign. Okay, so that is what we're doing this year. This is going to be extremely helpful. And as I had mentioned on the last call, Miss Gail was kind enough to share that she's going to save about almost $2,000 just from this program alone on her AEP campaign. So excited to help others share money with that. Okay. In regards to the AEP marketing plans, if you do have plans and projects, start organizing them now, whether you're doing seminars or working with the doctors or whatever you're doing. I am going to be sending out a new updated form for you guys to use. And that updated form is going to be basically a marketing plan template, and that will help us support you as best we can. So we'll go to the carriers and the provider groups, and we'll sync and link all the pieces together in order that we're supporting you the best that we can. Okay. So it's really important that we prep, get these things done. Many of you have signed up for the Spark platform, but you have not yet uploaded your book of business. Please make sure you do that, because you cannot use the AEP campaign. It won't work unless we have the information in order to mail those members and build those surveys for you. Okay. So really, really important that you get that done, because time is of the essence. Okay, let's take a look. We got a couple of chats here. Stan says UHC has rolled out in Cape Canaveral on Wednesday. Thank you, Stan. If you're in the Brevard market, please note that United Healthcare is doing a rollout session in that area. Just check the rollout area in the Gold Key. And I think United Healthcare has a link there. They do send emails and all that good stuff as well. Make sure that you're doing that. Will says, I was told that the call recording was targeting those companies that are call centers. Now, I am going to cover this on September 2nd in the update. It's going to, basically the big reason is the call centers have made it very difficult for us field agents to do business, but the call recording is required for all agents, including field brokers, starting October 1st, 2022. So that is why we need to do and get prepared now, because you don't want to wait until the last minute to get all this set up. So starting October 1, call recording is required for you, Will, and everyone else for all interactions with your clients, pre-enrollment, enrollment, and post-enrollment. Okay. Tina says, if we already were reporting prior to HPM Shop and reported in Shop as well, do we still have to upload our book? Could you clear this up? Because I've been told two different things. Okay. So yes, Tina, if you have been reporting or using HPM Shop, do not panic. We've got everything there. We just need to simply format it and get it uploaded to Spark. Your life is a lot easier because you've been using HPM Shop. So thank you very much. But you have done your due diligence, but John will help you clean it up and get it up to Spark. So we don't have to worry about missing anybody. Now, those of you that may have had business prior to HPM, or maybe you were using, paper applications, or you were using carrier enrollment sites, your business is everywhere. And so we really need to ensure that you're pulling all of your clients into one spot and getting them uploaded in Spark. Don't worry about duplications because we'll clean all that up. But just make sure that you don't forget anybody, because if you don't upload them, they won't get a postcard for AEP and you may miss a sale. So just make sure that you get that done. Will is asking, so the QR code is available and can be used immediately. And can we get a copy for our other marketing? I'm not sure exactly what you mean on QR code, but the QR code on the postcards are generated once you enroll in the AEP campaign. And yes, you will get a copy of that AEP campaign and the postcards that will be available to you for your members. So don't panic, all of that will be set up, but we've got to get you loaded into the system, book a business uploaded, and then we build the postcard to send out, and you'll get a copy of that postcard and a notification before it hits mailboxes. Okay. So yes, you will get a copy, and yes, that QR code is specific to you and that particular survey. Your picture is on it the entire time. So it's really cool. They know that it's coming from you because they trust you, right? So there you go. Okay, I've got 9:35. We went a little bit over today, but some great questions. I really appreciate everyone and their support. I appreciate your hard work. I appreciate you. Make sure that you get your AEP book up and loaded. You get your trainings done, certifications done. Go to those rollout sessions if you have time, because they are great information and a great way to network as well. Provider groups will be there as well. So very excited for all of you. As always, we'll see you here next Monday at 9 a.m. Thank you guys for being on the call. Have a fantastic